Hi, everyone, and welcome to the Parkinson's Foundation's PD Health at Home Wellness Wednesdays. We're so glad you're here. Today's Wellness Wednesday webinar will focus on pain and its role in living with Parkinson's. We'll review different types of pain, their causes, and various treatment options. We'll also learn to recognize the difference between general discomfort and true pain so we can effectively communicate our symptoms to our providers and to others. Our hope with offering this webinar is to provide you with education and tools to improve both your comfort and your quality of life. Before we get into it, I want to remind you of our other PD Health at Home virtual programs. Each week we offer sessions tailored to support people with Parkinson's and their care partners, including Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays, expert briefings, and our Spanish language series, EP Salud en Casa. Be sure to visit our website to see what's coming up and to explore our archive videos on YouTube. Our next Wellness Wednesday will be an expert briefing on gait and balance. And challenges that are commonly experienced by people with Parkinson's. We'll explore the common factors that can contribute to gait and balance difficulties, such as muscle rigidity, posture, and coordination. You can learn more about those upcoming virtual programs and register at parkinson.org/pdhealth. And finally, I'd like to invite you to our annual Care Partner Summit. This year's theme is Caring with Confidence, and we'll explore how care partners can strengthen their identity beyond supporting someone with Parkinson's, how to healthfully set boundaries, and to communicate effectively with themselves and with others. We'll also learn how to maintain our own well-being. Whether you're brand new or decades in, these conversations are designed to meet you where you are. You can learn more at parkinson.org/care summit. Now let's begin our webinar on understanding the difference between pain and discomfort in Parkinson's. Leading our lecture today is Dr. Meaghan Lynch. Dr. Lynch completed her medical education at Boston University, followed by a residency in physical medicine and rehabilitation at Northwestern University's Rehabilitation Institute of Chicago, now known as the Shirley Ryan Ability Lab. She's board certified in both physical medicine and rehabilitation, as well as brain injury medicine through the American Board of Physical Medicine Rehabilitation. Dr. Lynch currently practices at Kaiser Permanente in San Francisco within the Department of Neurology, and she's also an active member of the American Stroke Association. We're so glad to have you here with us today. Please join me in welcoming Dr. Meaghan Lynch.
Thank you so much, everyone, for having me. I'll go ahead and share my slides now. Right. And Kristen, Brianna, let me know if you're having any trouble viewing things on your end.
Great. Things are looking great, Dr. Lynch. Thanks.
Okay, so today we'll be reviewing the differences between discomfort and pain in Parkinson's disease. By the end of this talk, I hope you'll be effectively able to describe if you're having pain to a healthcare professional and how to describe it so that you can get a better diagnosis and treatment. We'll review different types of pain that are common in Parkinson's disease and what causes them, and explore both pharmacological and non-pharmacological pain management strategies. So discomfort versus pain is sometimes hard to tell. And living with Parkinson's disease, you might experience both. Discomfort is really just defined as something mild, an unease or an irritation. And in general, it gets better with self-care, meaning if you reposition yourself or you rest from certain activity that's maybe causing the discomfort, it goes away. Some common symptoms of discomfort in Parkinson's disease that are unique to the condition is stiffness and rigidity. So that feeling of difficulty moving those joints or your legs or your body, but it does get better maybe after you move a little bit or exercise or reposition. And dyskinesia is also kind of a common discomfort in Parkinson's disease. Some sort of abnormal excessive movements in your body, usually a side effect of your medications, kind of this restlessness feeling in the muscles or movements that are there, but again, not painful where it's really so bothersome, but it's there and it can be sometimes uncomfortable. Pain, however, it's more an intense experience. Pain is difficult to ignore. Um, if you're going about activities, is it hindering your movement or your activity? Is it preventing you from taking your walk or doing your exercise, or is it interfering with sleep? And pain can be emotionally distressing. So it's not just a physical experience sometimes, it can be an emotional one that really impacts your well-being and maybe even your relationships with people at home. So if you're not sure if you're experiencing discomfort or pain, ask your doctor. It's okay if you're not sure, and we will help you figure it out. If it's something a normal experience from Parkinson's, or is this something that we can maybe help diagnose and treat better for you? And I don't want you coming to your doctor and saying, I'm having this syndrome of pain. It's this, my x-ray shows this. This is what it is. It's better to come to your doctor with all of your symptoms and just kind of describing your experience in the physical and maybe even also emotional way. How is it impacting you? And the best way to describe it, I use a mnemonic that's old carts is the mnemonic. So OLDCARTS, each stand for something that helps us describe pain. And so actually when I see a patient in my office who's presenting with a symptom that might be discomfort or pain, I usually try to ask them these questions to get the details of their experience. So for example, O stands for onset. When did the pain or discomfort start? What were you doing? Were you trying to bend over and pick something up? Were you reaching for something and all of a sudden the pain started then? Or was there a traumatic event that the pain started at? When did it start? Was it sudden or gradual too? So onset of the pain. L in old cart stands for location. Where is the pain? Point to it. Show us where it is. And also, the location of pain, does it travel or move or radiate anywhere? That's helpful for us to understand. The D in old cart stands for duration of pain. So when the pain or discomfort comes on, how long does it last for? Is it a couple of seconds? Is it a couple of minutes? Is it a couple of hours? Or has it been going on for days? Does it come and go, intermittent? Or is it a constant feeling? Does it happen just during the day or does it just happen at night? The thing unique to Parkinson's disease too is the duration or timing of the pain or discomfort. Does it happen after you take your medications at a certain time or right before you're about to take your medications? Because sometimes the timing of medications can play a role. Um, the C in old carts of the carts word stands for character. I want you to characterize the pain. Don't just tell me it's pain or discomfort. I want to know a little bit more the quality of it. Is it burning, stabbing, shooting, sharp, pressure, dull, achy, tingly, electrical? So you can really use your vocabulary to describe your experience. And that helps us tease out where the discomfort or the pain might be coming from. A in old card stands for aggravating factors. What makes it feel worse? What provokes this discomfort? Are there things that trigger it? Is it happening when you're sitting down or is it happening when you're standing up and walking? R stands for relieving factor. So the opposite. What makes it feel better? What relieves this discomfort when it happens? Or do you, if you lay down, does it go away? Or If you bend forward and lean on something, does it go away? Do you stretch something out and it goes away? So relieving factors. The T in old card stands for treatments and response. So what have you tried at home to relieve your discomfort or pain? Anything over-the-counter medications, any topical remedies? Have you used ice or heat or massage? We want to know what treatments you tried, and maybe also prescription or medical treatments you tried in the past too. We want to know about that, what's helped, what's not helped. Both the things that have helped or not helped are relevant. Also, if you've had side effects of previous treatments that you attempted for whatever this pain or discomfort is, we want to know about that too. And then lastly, the S in old card stands for severity. How bad is your pain? On a score of 0 to 10, where 0 is no pain, 10 is the worst imaginable, where are you rating your pain right now on average? We use that number also to help us as doctors understand if you're benefiting from a treatment that we initiate. Then we can sort of see if you're improving. And you don't have to be exact on this. Everybody's scale of 0 to 10 is different. We just really care about your internal experience. And then also severity, you can tell us, is it emotionally distressing? Is it impacting your functioning at home or at work? So these are all things that we want to know. Now we'll move on to actual common types of pain in Parkinson's disease. So this is beyond just discomfort. I'll be reviewing shoulder pain, back pain, dystonia, and nerve pain. And that said, people can have other types of pain in Parkinson's disease too. These are just the most common four. So I want to hear from the audience participants here. Do you have shoulder pain, or does your loved one who you're caring for have shoulder pain? Let us know. So people with Parkinson's disease can experience shoulder pain from various causes. Individuals might experience shoulder pain from arthritis, degenerative underlying conditions to the joints. Individuals with Parkinson's disease are a little bit more prone to developing adhesive capsulitis, which the layman's term is frozen shoulder. So it's hard to move, it's stiff, and it's painful anytime you try to move it in any direction. And you could also experience shoulder pain from a rotator cuff tear. Sometimes maybe you accidentally fell and you're trying to save yourself by landing on your arm, but then you pull a rotator cuff tendon. So it looks like a lot of people with Parkinson's disease or your loved ones here experience shoulder pain, about 53% of you, a half of you, more than half of you. So what do you do if you're experiencing shoulder pain at home? First thing is don't stop moving. It's important to stretch out that shoulder joint as much as you can tolerate. The danger of not moving your shoulder if you're in pain is you can develop this vicious cycle of tightness and frozen shoulder where it's stiff and painful. And the more pain you're in, the less you want to move it. And the less you move it, the more stiff it gets and the more painful, and so on. So there are specific exercises and stretches that you can do that are safe. Sleep position is important. So don't sleep on that side that is painful. We don't recommend laying on that side if you're a side sleeper. If you are a side sleeper, try to lay on the opposite side, but you're also going to want to hug or tuck a pillow under the affected shoulder. So that'll give it some support. If you're a back sleeper, you might want to think about putting a pillow under the affected shoulder. And then using different topical remedies, you could warm up the shoulder with heat pad before you're doing any exercise or overhead activities. And if you're having some pain after activity or exercise, ice is good and a really helpful anti-inflammatory. Most over-the-counter pain relievers are safe for Parkinson's disease. So Tylenol or acetaminophen, Motrin or ibuprofen, Aleve, naproxen, all these over-the-counter pain relievers are safe and effective. A lot of them have anti-inflammatory effects that can be helpful if there's underlying arthritis or tendon inflammation. And if your pain is continuing or you're not sure, go see a doctor. And a doctor can help you because they're going to be able to do a more detailed physical exam of your shoulder and figure out what is it coming from. Because again, like I said, there are so many different ways that somebody can experience shoulder pain. They might be able to order an x-ray for you if they're not sure there's underlying arthritis or a fracture. Doctors can prescribe you some more specific prescription medications to help with your pain. Physical therapy is really, really helpful and important. They'll be able to show you more personalized stretches and exercises for your shoulder. And your doctor might even administer a cortisone injection. So usually this isn't done by a neurologist though. So you might want to consider seeing maybe initially your primary care doctor. They're a very good go-to person for shoulder pain. Or a physical medicine and rehabilitation doctor if you have one. They are excellent at musculoskeletal diagnoses that exist in neurological conditions. So when somebody's having pain, but they also have a neurological condition like Parkinson's, we are here to help you. Moving on to back pain is a very common experience in Parkinson's disease. How many of you have back pain? Can we pop up the poll here? Great. And back pain can come from various things too. If you think about Parkinson's disease, oftentimes there's a stooped posture, a sort of leaning forward, stooped posture. This can put a lot of pressure on the bones and the discs of your spine. If you've fallen, there might be a chance of traumatic injury to your back. If you even like a fall where you land on your butt, can actually sometimes lead to a compression fracture in the spine if you have underlying osteoporosis or fragile bones, which is common with older age and immobility. And I'll end the poll so you guys can see the results. So about 78% of you or your loved ones are experiencing back pain, super common. It's really common in Parkinson's disease. It's also just really common in the general population too, to have low back pain. So really kind of, and also you should know that low back pain is a leading cause of disability in the United States. So people with Parkinson's disease and low back pain is really going to impact you functionally. So if you're experiencing back pain, first thing is try not to lift anything super heavy. Even sometimes like a pretty big weight, if it's not held in the center of your body, can put a lot of strain on the discs of your low back. So if something is on the floor and you need help picking it up, ask for help. If you have a mobility aid, this can actually sometimes help your back pain, especially with the stooped posture, or if there's compression on the even the nerves in your spine. Leaning forward on a walker for support can help. I'll go through a few adaptations in terms of avoiding heavy lifting, what you can do. But one example, if you do have to pick up something off the floor, is instead of bending from your spine, squat and kneel to get to the floor to pick something up. Sleeping, so getting in and out of bed, try not to throw yourself or twist when you're getting in and out of bed. There are different ways to sleep also so that you're more comfortable. If you're a back sleeper, you can put a pillow under your knees and it can ease a little bit of tension on your spine. If you're a side sleeper, you can put a pillow between your knees, and that just kind of helps align the spine so there isn't any big curve when you're sleeping on your side. Similar to the shoulder pain, you can use heat packs or ice packs, uh, both really helpful. And then also similarly, over-the-counter medications like acetaminophen, ibuprofen, naproxen, all these are generally safe. Don't interact with your Parkinson's medications. If you're not sure if they're safe for you, again, ask your doctor. Here are some examples of adaptations to daily activities to mitigate your back pain. So instead of bending forward to put your shoes on, you can use a long handled shoehorn here on the top right. Instead of bending over or even squatting to pick something up off the floor, you can use a reacher grabber device that's at the bottom. And then when you're sitting, having good posture is key. So it's normal to have curvature in your lumbar spine, and we want to promote that. So rather than sitting like a bent cashew forward, having something be behind your lumbar spine to help you with better posture is going to reduce the forces on your low back. Here are some mobility aids to help get in and out of bed without having to twist or move with excessive strain. So on your right-hand side of the screen is a transfer pole. So using that, pulling up with your arms to stand rather than maybe twisting with your back. Or on the left-hand side of the screen, this is a bed rail. They come in all different shapes and sizes. Some of them don't even go onto the floor. They can fit under your mattress and just makes it easier to get in and out. Here are some mobility aids that help with back pain if you have a condition called lumbar spinal stenosis. Even just leaning on a grocery cart can ease up some of the tension on your spine. Or a regular walker on the right-hand side of the screen. And the walker in the middle of the screen is a U-step walker. This is a pretty common walker for Parkinson's disease because it helps a little bit with improving your stride length and has a nice balance and many wheels that make turning easier. So if you're experiencing pain in your back or discomfort and you're not sure which one it is or what to do, go see a doctor and we can help you. We can do a detailed physical exam of your spine and see and get a sense of what this might be coming from. Your doctor might order an x-ray or even an MRI scan of your spine to help with the diagnosis. Prescription medications beyond what you can find over the counter can be really helpful for back pain depending on the cause. Your doctor or physical therapist might prescribe you a TENS unit. So that's a transcutaneous electrical nerve stimulator. Different pads that you put on the area of pain in your spine. It helps send signals to the painful nerves in the back and dampen down that pain response. Back brace. So this is generally, we don't recommend going out and buying a brace for your back. A doctor will prescribe it for you if there's a really specific indication of a compression fracture or maybe severe scoliosis. But generally, we don't recommend a back brace for other types of back pain because it might weaken your muscles if you're relying on it too much. So the really specific indications that your doctor would prescribe a back brace if it's necessary. Oops, I'm going backwards somehow. Okay. And then your doctor might refer you to physical therapy or occupational therapy to help with managing your back pain. We know physical therapy helping with stretching and posture and strengthening and helping your core and your balance. But occupational therapy is very helpful too. As you know, like you have to use your back a lot for reaching to get dressed or reaching to cook or getting on and off the toilet or in and out of the shower. So OT actually can really help with adaptations to make those easier and less painful. Lastly, if your pain is ongoing despite a lot of other treatments that the doctor has prescribed, they may recommend you getting a cortisone injection into the spine or other procedures such as radiofrequency ablation or a spinal cord stimulator, which some of you are probably familiar with deep brain stimulation for Parkinson's disease. Well, there's also spinal cord stimulation for chronic pain. And actually it is safe to have both, but generally that's sort of, a last ditch thing if maybe you're not, um, your pain is not relieved by other interventions. And certainly sometimes if there's a spine thing going on that's not relieved by all of these things, sometimes people ultimately need surgery, but we try to avoid that since going under anesthesia for surgery can have its a lot of cons when you have Parkinson's disease. Okay, so moving on to next common pain phenomena is dystonia. So we can make the poll here. So how many of you or the people you care for experience dystonia? Dystonia can be kind of painful too. So if you're not sure what it is, I'll just describe it a little bit. It can be the pulling or spasming of a muscle or a limb or even your neck, a joint that is sort of cramping or pulling or twisting, not under your control. So it's a spontaneous phenomena. It's very common in Parkinson's disease, pretty unique to Parkinson's disease or other movement disorders and neurological conditions. And in Parkinson's disease, it commonly happens in the foot, where maybe the toes curl inward and the foot turns inward, or the toes go upward. Also can happen in the neck, a twisting, kind of curving of the neck. And so what I'm seeing on the poll so far is that 63% of you experience dystonia. So it's a pretty common experience for a lot of you. Now, if you experience dystonia, what should you do? Before you see your doctor, actually, keep a diary of the pain you're experiencing. You might not even be sure if it's dystonia or not, but when the pain occurs, write that down in terms of timing. What were you doing? And also, what time did you last take your Parkinson's disease medications, like your Sinemet, levodopa, carbidopa? Because there can be a correlation with the timing and how you take that medication. Um, you could take a video or a photo of the dystonia if you're seeing an active like posturing of your limb or muscle in a certain way that is painful, so that you can bring it to your doctor when you go see them, because you might not be experience a dystonia when you go to be seen by the doctor. So having that so they can visually see it is helpful. Dystonia often occurs when your Parkinson's disease medications are wearing off. And so make sure to take your Parkinson's disease medications on an empty stomach and always on a nice time schedule. Try not to skip a dose. And then things also you can do at home for the area that might be experiencing dystonia is trying to stretch that area and stretching it both in the morning when you first get out of bed and also before you get into bed. So making it part of your routine, like brushing your teeth. And if you are experiencing the dystonia, um, make sure to tell your doctor about the experience. And remember those old carts, all the descriptions of how to talk to your doctor about pain. Make sure to tell them about those things. And your doctor will do an examination, neurological, maybe musculoskeletal, and help try to rule out other factors that could be contributing to your dystonia. Physical therapy or occupational therapy can help depending on the area of dystonia you're experiencing. oftentimes, your doctor's going to need the help of your neurologist to adjust your medication. So usually with dystonia, you do want to let your neurologist know about this, because maybe the timing of medications needs to be changed, or the dose needs to be changed, or the medication needs to be changed. So there can be some fine tuning of the medications to help with dystonia pain. And then if it's a really focal area where the muscles are really just pulling and twisting and medication adjustment has not helped, an injection into that muscle using botulinum toxin can be helpful. So I'm not sure if people are familiar with botulinum toxin, but the really common brand name is Botox. And a lot of people know about Botox cosmetically because it's injected into muscles of the face to reduce wrinkles. But it's a muscle relaxant. When injected into the muscle, it relaxes that muscle. The muscle tension really goes away. And so a neurologist or a physical medicine and rehab doctor can do a Botox or botulinum toxin injection into the muscle that's being affected by the dystonia to calm it down. And those injections can be done as frequently as every 3 months. There's some newer brands of botulinum toxin out there that are now extending the effectiveness to up to 6 months in some individuals too. So some new brands out on the market. Okay, and then lastly, another common pain phenomena in Parkinson's disease is nerve pain. And like to start the poll to see how many of you have nerve pain. Nerve pain can come from different sources. So you might have burning, tingling, numbness in the feet from peripheral neuropathy. You could have compression of individual nerves in certain areas, like in the carpal tunnel of your wrist, which can manifest in tingling or pain and numbness in the hand. Or big nerves can be impacted, like the sciatic nerve in the lumbar spine, or the gluteal area can get pinched. You can have shooting pain down the leg. And looks like about 70% of the individuals are experiencing nerve pain in one way or another. So very common. What should you do if you have nerve pain? Well, at home, stretching or massaging the area is going to be good. Even if you're having a lot of nerve symptoms, you don't want to avoid touching the area or sort of avoiding it. So massaging it or rubbing it is going to actually be helpful in a way, sort of like desensitizing the nerve. Some contrast bath. So what is that? Putting the area, maybe say it's your hand or your foot that has a lot of nerve pain. So first soaking it in a warm bowl of water for 5 minutes, and then switching it to a bowl of water with ice water. So going from warm to cold and doing that for 5 minutes at a time can help stimulate the nerves. Different hormone and vitamin deficiencies can make nerve pain worse. So making sure your diet is well-rounded with B vitamins help with nerves. Also iron. So if you are deficient in either of those, you want to consider supplementing. I don't recommend just going out and starting to take extra vitamins if you have already a well-rounded diet. But if you are sort of like vegan or vegetarian, you might want to consider adding those. And the other thing is avoiding alcohol. So we know that alcohol injures nerves, especially the small nerves of our feet and hands and nerves in our brain. So avoiding alcohol. If you see your doctor and you're not sure if you're having pain from nerves, of course, you want to let them know about your symptoms. They're going to do a pretty detailed examination of your nerves to help figure out which nerve might be impacted and why. They're the ones that can order blood tests to see if there's like a hormone deficiency or vitamin deficiency leading to the nerve issue. They might order a nerve conduction study or EMG, electromyogram. So this is a test done by a neurologist or a physical medicine and rehabilitation doctor that uses electrodes to stimulate the nerves in the area that is affected to see if the nerves are sending signals properly or not, and can help diagnose if a nerve's being pinched somewhere. There are specific prescription medications to help with nerve pain. So fortunately, there aren't many over-the-counter pain relievers for nerve pain in terms of pills, but prescription ones can be very effective. There are some over-the-counter topical medications now for nerve pain. So lidocaine gel or lidocaine patches. I think the brand Salonpas makes one. Can help with specifically with nerve discomfort. And then depending on the area of the nerve being injured or compressed, your doctor might refer you for a nerve injection or nerve block. So I've already gone over a lot of different pain conditions in Parkinson's disease, and from the poll, now seeing this, you're experiencing pain, 50 to 70 to 80% of you are experiencing pain in one way or another. And pain can be a difficult experience, not just physically. It can be an emotional experience. It can really wear on us. It can make us irritable or unhappy. It makes us avoid certain activities or fear certain activities, and that can be pretty isolating. And so while I've already talked a lot about the sort of physical approach to managing pain and working with your doctor, there is the other approach is the mind-body approach, and that's just as important. So remember to breathe if you're experiencing pain. And you might have learned some of these breathing mindfulness techniques in these wellness series online with the Parkinson's Foundation. Mindfulness body scan is one type of mindfulness meditation that helps individuals sort of go through their different body parts and relax them in a guided way. Guided imagery is another technique of mindfulness that helps with managing pain, sort of in the way of taking your mind off of the discomfort or unease. And so that is, so an example might be listening to a meditation that takes you into a beautiful place like a forest where there's a stream and beautiful trees and leaves, and you're imagining all these pictures and your mind is getting off of the pain. And then even individualized mental health therapy can be helpful for pain when it's really impacting you emotionally on top of that physical experience. And there are actually specifically trained pain psychologists that can help when the physical aspects of pain are taking more of an emotional toll. And how do we prevent pain in the first place in Parkinson's disease? Well, not everybody's going to experience pain, and also pain can go away, right? But we want to keep active and do what we can to prevent it from cropping up. So first thing is make sure to take your medications as prescribed and on time. And if you're not sure about your meds, approach your doctor and ask them about it before you discontinue one. Never stop moving. So exercise is key. We know that exercise slows the progression of Parkinson's disease, helps you be as independent for as long as possible. And whatever exercise it is, make sure it's something that you love to do. Don't make it a chore. So whether it's dancing or boxing or yoga, make it something you love. And I'm going to do a shameless plug. I love dance and ballet. And so at the San Francisco Ballet, there is a class for individuals with Parkinson's. If you happen to live nearby, that's great. You can come to the classes in person. Or there are video-based classes on Zoom and a few saved classes on these links here that you can check out the dance classes for individuals with PD. So at this time, I will take questions.
Thank you, Dr. Lynch, so much for guiding us through an understanding of what's the difference between pain and discomfort, rolling us through some of the common experienced pain in Parkinson's disease. And I would love if you could share, Dr. Lynch, what the essential role is of the relationship of exercise and pain. Why or how does exercise or movement alleviate symptoms of pain?
Yeah, I think it kind of depends on the source of the pain. Movement in general in Parkinson's disease is going to help with that stiffness, rigidity. A lot of the exercises that are helpful for Parkinson's disease are focusing on expanding your movement. So you can see me on the camera. I'm like, big movements are key. And exaggerating those movements. So that's going to alleviate a lot of the discomfort of stiffness or rigidity. Um, Now, if there's a specific area of pain, like if it's your shoulder, you're going to get specific exercises from your physical therapist for that. So it's a little bit separate from like the PD exercises. Again, if you have back pain, depending on the cause, a physical therapist might prescribe really specific exercises for your back
Mhm.
beyond just exercises for Parkinson's disease.
Is there a relationship of establishing strength, say in the low abdomen and what is commonly referred to as our abs, our core, that can help relieve back pain?
Yes, so that's a lot of what a physical therapist is going to focus on and help with is strengthening the core, your abs, your posture, your trunk.
Mhm.
So counteracting a lot of that pulling, we want to help with your posture, and that can alleviate the pressure on the spine. You might
Mhm.
find some of those exercises also in Parkinson's disease classes, for exercise-based classes that are specific to individuals with PD, because a lot of them also focus on posture and balance and core in a safe way. And it sort of depends if you're finding like those classes are helping you with your pain, keep
Mhm.
at it. You don't have to necessarily go see a physical therapist, but if you're still experiencing your symptoms despite your PD based exercises, then you can get some more individualized approaches that way.
Great. And Dr. Lynch, would you just end your share screen, please?
Oh yeah.
Thank you. My friends, we're getting a lot of comments and questions that are really specific to your unique experience with Parkinson's, and just want to lay the disclaimer that we're not able to provide really specific insight or feedback because we just don't know your full story. So highly encourage you, for those of you who are writing in with more specifics to your journey to talk to your doctor about that. So, Dr. Lynch, can you let us know if is a lack of dopamine related to the cause of pain in Parkinson's?
For dystonia, it's
Mm-hmm.
specifically related to dystonia.
Mm-hmm.
Yes. Other than that, like for the shoulder pain, for example, or the back pain or nerve pain, it's not so much related to dopamine, but dystonia is a really specific phenomena that is related to dopamine fluctuations. Um, Dyskinesias, which can be a uncomfortable experience, but usually not painful, that is also related to dopamine fluctuations. So sometimes you're not sure. Is it dyskinesia? Is it dystonia? And you
Mm-hmm.
can go and ask your neurologist, and they'll be able to really tell you.
Okay. I'm hearing a lot of insight to speak to your doctor, ask your neurologist, share these experiences that you're having, that may be discomfort or uncomfortable and potentially chronic pain. And so, someone wrote in here, there's this phenomenon that can happen when we start building a long-term relationship with pain. And there's almost sort of a lack of sensitivity to it, right? Our body starts to adapt to the pain, and it just sort of becomes a this is how it is in my body. And so we have a viewer who writes, what would you recommend for someone who doesn't report their pain in detail and experiencing how they sort of self-filter their ability to report the pain that they're experiencing? What would you recommend for someone who's not really reporting this experience of pain and living with Parkinson's?
Mm-hmm. I think if you're not able to really report the pain in that, old cart's description that I went through, is describing how you are limited by your experience. So I can't do XYZ because of my pain. I can't go and take a walk because of my pain, or I can't go play the game that I used to play because of my pain, or I can't take care of myself in this sort of way because of my pain. That is a really helpful information too. And um, yes, at some point, maybe you've gone through all of the treatment options with your doctor for pain, and you are living with chronic pain, and it's a really challenging experience. But we don't have a cure for everything, unfortunately. And if you are dealing with pain, I want to make sure you're not having the emotional um, baggage from that, right? So if you're coping with the pain in a way that is manageable and you're finding ways to deal with it, that's okay. But I think if you're finding like you're suffering from the pain, we don't want you to be alone, and we don't want you to feel that way, because there are things for you.
How could one identify that they are suffering from pain? What are some
Hmm.
things to look for or to be aware of?
Hmm. So I think fear of activity, if you're in a lot of pain, is something to be aware of. If you're having depression or anxiety because of the pain, that is suffering from pain in an emotional sense. If you are finding that your relationships are changing with your loved ones or your family because of the pain you're experiencing, that's something we don't want to ignore.
Mhm. Yeah. There's a fascinating comment here from one of our viewers, and they share these pain conditions seem to be common in the general population. Frozen shoulder, back pain, dystonia is very specific to Parkinson's disease, nerve pain in general. And they're curious, how does Parkinson's change or impact these more common pain conditions?
Yeah, it is harder to move with Parkinson's disease, and we do rely on a lot of exercises to help with pain, but if it's harder to move, it's hard to do the exercises. And especially with that rigidity, it really impacts recovery from a shoulder injury or a back injury. And yeah, unfortunately, it can be a vicious cycle. I feel like I've seen some of the worst back pain and spine conditions in individuals with PD. And the treatments sometimes don't work quite as well as the when we were treating somebody who doesn't have PD, just because we have that just sort of added um, barrier in a way. It's a tough disease.
Mhm. Now, I'm curious. It's so fascinating. I haven't received a question related to medical marijuana or cannabis in quite some time, a couple of years when it was approved for relieving some symptoms of Parkinson's disease. And one of our viewers here is curious if medical cannabis can be useful or supportive to someone who's experiencing pain related to Parkinson's.
Mhm. To be honest, I don't know. It's not something I've really investigated myself. So fortunately, I can't give you a good answer to that.
Yeah. And that seems to be the universal response from our providers and physicians is we don't have enough information. It's not a treatment that has been well studied, that has been well researched, and specifically to Parkinson's disease. And I've also heard physicians say, if it works for you, great.
Yep.
Okay. There's a fascinating question here that I want to ask you, Dr. Lynch. Someone's asking, how can we relax while we're moving? And please correct me if I'm interpreting this incorrectly. So while you're moving, you can tend to like flex a muscle, and then having that sort of tendency to try and relax. Maybe it's in the face, maybe it's in the body. So could you just speak to being able to relax while you're moving?
Hmm. Yeah, it's pretty tough. I mean, when you're moving, you aren't relaxed. You are active. You're activating. So I think that it depends on what you're doing. There are types of movement that are dedicated to relaxing. So yoga,
Hmm.
or Tai Chi, or Qigong. So different movements that are related to relaxing. And oftentimes the key is breathing and breathing during the movement, as a way to relax. Uh, and then also imagining something. So I don't know too much about the Qigong or Tai Chi, but I think there's usually you're imagining doing something with your hands or your legs. And so that imagery is helping also guide you into relaxation.
Yeah.
But a lot of physical movement is going to be activating. So relaxing does require you to stop moving sometimes. That's why oftentimes when we do mindfulness or meditation, we want to be in a quiet spot. We're probably sitting down or we're laying down and our eyes are closed and we're really focusing on a different way. Um, a lot of Parkinson's disease medications, your prescription medications, do have a side effect of having you keep moving in a way. Those kind of dyskinesias and moving around, and you might think you're relaxed and sitting, but you're moving. And that's it's something that you necessarily can't overcome. But if it is disturbing to you, talk to your neurologist about it because might be able to help make some adjustments.
It sounds what I'm hearing, Dr. Lynch, is it begins with awareness. And this experience that we have with pain is one being aware of it, and that mindful sort of approach of recognizing that it's here, and then choosing to be present with it and breathing with it. And when we speak about this idea of relaxing while in movement, I imagine I'd love to just indulge everyone here for a moment. Lift your shoulders up towards your ears and then consciously relax them down in a way. Good. And kind of like shake your shoulders from side to side. You might even notice in your face if there's any scrunching from your hairline to your eyebrows or around the tiny little muscles of your lips. Yeah, so just being aware with those spaces in the body that feel neutral, and then we can start to move some of that awareness into the spaces of the body that don't feel so good. And then we can use those tools of mindful and awareness to relax into the pain. All right, we have time for just a few more questions. This is a good question to bring up about imagined pain versus real pain. So you touched on this, Dr. Lynch, a little bit about the psychosomatic relationship of pain, and its relationship of experiencing pain and fear of feeling that pain by doing an activity. Could you just speak to a little bit about the relationship of the psychology of the mind and the sort of somatic relationship that our mind can really have on the experience of pain?
Hmm. So pain can be a little bit of a learned phenomena. So your brain remembers memories, right? So if you have an injury and your brain is, experiencing and feeling that pain and the injury is there, your brain is remembering it, and at some point your brain really is solidifying that pain and here, even though the maybe the injury is down in your hand or your arm or your leg. Um, and so your brain is remembering that pain experience. Uh, and then we call that centralized pain,
Mm.
actually. So, and it can happen in chronic pain, but then your brain is fearful of maybe doing activity with that limb or that area that was injured, even if maybe the injury is gone. You can still experience the pain in that area.
Mhm.
So again, your brain can remember that pain, or it's a learned phenomena almost. But there is ways of unlearning that pain too, which goes back to the mindfulness and ways to try to disconnect your brain from the previous pain event so that you can overcome that fear. Um, some of it sometimes is working with a physical therapist or a pain psychologist to get you out of that fear and to try something and know that you're not going to re-injure yourself.
Mhm.
I'm not quite sure if I answered the question, but yeah, I can try to elaborate any more if there's something else there.
There, you did mention centralized pain, and we had one of our viewers ask, like, could you just talk about central pain a little bit more and help us understand what that means?
Hmm. Yeah, so sometimes like when it is a chronic pain and the pain is not just in the body but in the brain, um, there are different approaches to managing that and actually different types of prescription pain medications. And some medical centers have a multidisciplinary pain clinic or pain center where you can approach the pain at all directions that it comes from to treat it when it becomes centralized. So part of it is physical therapy and learning to move in a safe way that you aren't fearing activity.
Mm.
Part of it is pain psychology. Part of it sometimes is acupuncture or biofeedback. I don't know if you've ever talked about that before, where like say there's an area of tension that you're gripping because there's pain and you fear moving that area. Let's say it is your shoulder. The clinician can put electrodes over the muscles around your shoulder and can see if you are gripping those muscles and not relaxing it. And you can see those waveforms of the muscles being under tension and try to relax them, knowing that you're getting that feedback. And you can also see your heart rate on the screen and see, can we reduce your heart rate? Can we slow it through breathing or relaxation techniques? And so that's a sort of a way to unlearn some of the chronic pain or centralized pain
Mhm.
that a multidisciplinary pain clinic can provide. And they have a lot of other resources too. Usually there's a doctor there too that can help with prescription medication and a pharmacist. Because some of those medications, when it comes to like a central chronic pain that you're just sort of living with all the time and suffering, medications are often different than just prescribing something for the injury itself.
Mhm. Mhm. So, as we kind of round out our time today, Dr. Lynch, I have just one more question from one of our viewers. And they ask, does Parkinson's exacerbate pain, or are these symptoms just more associated with getting older?
Oh, yeah, good question. So a lot of these painful conditions are associated with getting older, right? We do experience a lot more wear and tear in our bodies with age. I think that there's a little bit more propensity to develop it in Parkinson's disease because of the stiffness, rigidity. But Parkinson's disease in and of itself is not supposed to be a painful condition. We know it's a movement disorder. It's not a pain disorder.
Mhm.
So I would say it probably increases the amount of chance of pain by a little bit, but not a lot of it. So I don't want you going out thinking I have Parkinson's disease. I'm going to develop horrible pain as I, progress through this condition, and that's not true. I mean, you might have pain here and there as things come on and little injuries, but for the most part, you will be able to overcome them. And so I don't want you thinking because I have Parkinson's disease, I'm going to live with chronic pain. There is a lot of help for you if you have an injury or pain condition, but it shouldn't be like a one of hopelessness. We can help if there's something that comes up.
Thank you, Dr. Lynch. Any final words you'd like to share, key takeaways that you want to reiterate before we close our webinar today?
Um, yeah, just never stop moving. Keep up with all the exercise that you do and stay motivated and talk to your provider if you're not sure, if you're experiencing something that is normal or not. So yeah, it's great to be here. Thank you so much for having me.
Thank you, Dr. Lynch. Really appreciate all that you do to support everyone living with Parkinson's, impacted by Parkinson's, and the work that you do in the field. So thank you for being here today at the Parkinson's Foundation's webinar.
Bye, everyone.
All right, my friends, just a reminder about this year's Care Partner Summit. Please don't hesitate to register to learn more about caring with confidence. You can visit parkinson.org/care summit and recognize that there's lots of questions that went unanswered today. And I encourage you to reach out to our helpline at helpline@parkinson.org. You can also call them. Our helpline is staffed by Parkinson's disease specialists. Some of the things that Dr. Lynch mentioned, our helpline staff will be able to guide you to those resources. Today's webinar was recorded. You will get an email from us with the link to the recording as well as the PowerPoint presentation so you can access those resources. Lots of interest in that dance session, Dr. Lynch, that you mentioned. So we'll be sure to share that information with everyone in the coming days. All right, my friends, until soon, may you find comfort and ease in your bodies and in your minds.